Hello and a very warm welcome to the special presentation of Sanjeevani United Against Cancer, an endeavour that began in 2023 with the aim to raise awareness on early detection of cancer and drive advocacy for regular screening, an endeavour that has the potential to save lives. This journey brought to fore some startling facts. Breast cancer emerged as the leading cancer and the most urgent cause for concern. 25% of all cancer cases for women are breast cancer, a type of cancer affecting younger people. 48% of women affected with breast cancer are below the age of 50 years. Delayed diagnosis and not getting the right treatment at the right time have contributed to these statistics. To combat this problem head-on, we are excited to launch Treat to Beat with Novartis India. This is an initiative aimed at driving meaningful conversations and activation towards better outcomes for breast cancer patients. As we look towards the future with positivity and hope, let us begin our discussion today by inviting our esteemed panelists. Joining me here in the studio, Dr. Ashish Joshi, Director and Co-founder, Mumbai Oncocare Center. Chhavi Mittal, actor, influencer, and a breast cancer warrior. Amitabh Dubey, Country President and MD, Novartis India. And Dr. Amit Rauthan, HOD and Consultant, Medical Oncology, Manipal Hospital. First of all, thanks to all of you for taking out time. I know every one of you keeps a very busy schedule, so talking about this topic and sharing your stories, I'm very grateful to all of you for that. Amitabh, let me start with you. Treat to Beat sounds extremely meaningful, significant. What were the various factors that contributed to the start of this awareness campaign?
Thank you, Mugdha, for this question, and it's an honor to be here. Let me first start by saying that cancer touches almost everyone's life, directly or indirectly.
Absolutely.
We all have somebody whom we know, a near and dear one, who has been affected by cancer. There's so much awareness about cancer, but when you look at the screening and the incidences, we always see a lot of patients getting diagnosed in late stages, plus the screenings are still very, very low. Also, there's a lot of visual and emotional stereotypes attached with cancer. An example could be that whenever somebody hears cancer, it's fear, it's always associated with same brush which is painting everything, same type of treatment. Not realizing that today there are different treatments for different patients, and different patients can have a potential to get cured by speaking to their doctors and having that hope to live forward. 150,000 people get impacted by breast cancer every year in India. And it's very, very important that each of them are able to have a conversation with their doctors and get to understand where they are in their journey, and also look at what's the hope for them for future. And that's where Treat to Beat comes in, because it's very, very important to empower the individuals, the families, caregivers, the patients themselves, to have a full knowledge about cancer, about breast cancer, and about the journey that they are going to take. And that's where Treat for Beat comes in. It's not just an initiative, it's like a movement where we want different stakeholders to get involved, whether it's doctors, it's survivors, warriors, it's patient organizations. Everybody has to come together to make more knowledgeable the community which is surrounded with the breast cancer. And last but not the least, for us, Treat to Beat is our hope for a better future for breast cancer patients.
Chhavi, first of all, thank you so much for sharing your journey with us and agreeing to talk to us about it. It's brave. And also because, a lot of times people think, agar cancer ko humne piche chhod diya hai, we don't want to look back towards it. But, I'm so glad that you are here sitting with us today. Would you be comfortable taking us through your journey and what happened and how it happened?
There is this big ostrich mentality that if I don't know it, it doesn't exist. And a lot of women think like that no, this cannot happen to me. And of course, when I was also told the first time that this lump could be the wrong kind, you should get it checked, you should get a biopsy done, I was so sure that these guys don't know what they're talking. All these doctors don't know what they're talking, and I know because I know my body. I know that I'm healthy, I follow a good lifestyle, I'm very particular about what I eat, I sleep on time, I wake up on time, I've had healthy pregnancies. I've checked all the boxes for not having breast cancer, and still I had it. So this is the biggest myth that I want to break, that just because you think or you don't want to have it doesn't mean you cannot have it. When I was diagnosed, I did not panic. I wanted to know what it is. What is breast cancer? I've only heard about it as a layman and not having any experience with it. I only know what is it, breast cancer. Before panicking, let me find out what it is. So I called all my doctor friends first. So there were plastic surgeons, there were breast cancer surgeons, oncologists, and survivors. And I asked them, what is it? And now I thought, okay, now I know it all. Now let me go and talk to my own surgeon. Okay, and he also assured me that your cancer, we've discovered it in the early stages. You're very lucky, you're going to survive, and it's going to be great. And this is the surgery that I'm going to do, and it's all going to be fine. But the one question that nobody could answer for me was, what is my life going to be after I survive? Yeah. Because it's not just about surviving. Will I be whole again? Just surviving is not living.
You want your life back?
I want my life back. Will I be able to? I mean, you tell me that if I work hard, it'll be slow and I'll have to be patient. All that is fine. Will I be able to get there? Should I even try, or are you telling me that no point trying? So I had a lot of support from people around me. Sometimes my loved ones think I'm crazy, but I know that I have been able to understand my body like never before after the cancer.
It's not cancer per se, but what cancer brings, even when it is leaving your body, is draining. So, there is a reason why they call you warriors. I have to say that. Dr. Ashish, I have the recent data from ICMR that shows that overall survival rate for breast cancer patients in India is 66%. In certain urban cities, this number can go up to 75%. What do you think has contributed to this, and how can we keep progressing in the right direction?
So survivorship in any cancer, and specifically breast cancer, is highly contingent upon the prevention and the awareness. So as you could see, the gap between the rural versus the urban India, since the awareness obviously is going to be much more conspicuous in urban population, as far as the mammography and the screening is concerned, you're going to see a better results. And that's precisely what we're talking about. It's just being aware that it's a preventable disease. It's very important that every woman above XYZ age limit should undergo a mammography, and that's possibly looking at age of 40, 45, and just being aware that breast cancer lump is a painless lump. And that typically what happens in our clinics, that patients do not experience pain, and hence they come very, very late as far as the breast cancer is concerned. And that's where you see the gap. So it's just making aware, having access to a mammography and the screening, that is what is going to make a difference.
Dr. Amit, what is your opinion on this? Where is the gap and how can we bridge that?
Thank you for having me. There's a gap at multiple levels, but I think the first gap starts off with the awareness and fear of the word cancer. And that's something that really scares people. And many of them would have a suspicion they'd have cancer, but they're afraid that it'll turn out to be cancer. And that's the reason they will not come in for a checkup. And then they'll come in with a late stage. And that can create a situation where you're not catching it early and catching it at a late stage. So the scare and the fear of the word cancer should go. And we keep saying that, we shouldn't use the word cancer, saying that cancer is a bad thing. It's just one of the diseases. And once we realize it, we will conquer it. So fear of word cancer is what we should always avoid. The second part is, the way treatments have changed. Patients need to understand times have changed. This is not how it was 20, 30 years ago. You're talking of surgery. Surgery can be breast conservation surgery. You're not even talking of removing the breast when you catch the lump very early. You're talking of advanced radiations, which are just being given for a selective number of days. You don't talk of radiation for a month. For breast conserved patients, you're actually talking of radiation 2 weeks, and nowadays even 1 week. When you talk of chemo, there are so many patients who don't require chemo because you have caught it in the early stage and you have these genomic tests which tell you, is my cancer a low-risk cancer which will not recur, or a high-risk cancer which will recur? We also have advanced technologies. We have immunotherapies, targeted therapies, biological therapies, apart from the chemotherapies. And we also have hormonal therapy. So we keep telling that scare of cancer should not be there. If you're diagnosed with cancer, we always say, let's find out what stage it is. Let's take care of it with the best available treatment and let's get back to normal life. That's the most important factor. Cure is possible, one needs to aim for it. And even in stage 4, we say there are so many advances in cancer management that even stage 4 can be beatable in breast cancer.
Amitabh, I just wanted to speak to you. Do you think the awareness needs to be at the level of our geography, that, why our cancer is different from the cancer that is being researched outside?
For me, two areas where I would really, really want to focus, if we really want to treat to beat, is creating awareness. People should know. People should know the importance of living healthy and importance of detecting early. If we are able to detect early, we can tell you a lot of cancer would have the similar responses as in the Western countries. We have poorer responses because we are detecting a bit later in the stage. And the second most important point is that how do we ensure that we reach to the right physicians and the right doctors at the right time to get the treatment done. These two important parts, if we are able to play out in the country, I can tell you our results are going to be equivalent to the Western world.
All right, in the next segment, we will delve deeper into living with breast cancer. So stay tuned, we'll be right back. Welcome back to this special episode of Treat to Beat, an initiative in partnership with Novartis India to drive better outcomes for breast cancer patients. Dr. Amit, anecdotally, we hear that breast cancer is supposedly good cancer. Is there really such a thing as a good cancer?
Diagnosis of any cancer affects the patient, and it also has so many effects on the family and their whole life, and the whole life changes. And I think this is something that we always say is something that better not to say that to patients. So this is a good cancer and that's why it's going to be fine. We tell what is the cancer, what is the stage, what is the statistics with that cancer, and what all you can do about it. But the other side of it is the statistics of breast cancer are good. Early stage breast cancer is a curative disease, and we keep saying you can cure the disease. And that's the reason why the awareness of early stage is so important. Also, we are seeing even breast cancer, if caught in the advanced stage, has so much more you can do. And that's the reason why some people would say it's a good cancer. It's not that, it's just that there are so many new modalities of treatment which are very, very helpful in breast cancer treatment.
Thanks, Doc. Thank you so much. Dr. Ashish, according to you, what will make this initiative successful? Do we reach out to more people? How do we do that? How do we bring them on board? What do you think is the way forward, and where are we standing at the moment?
The whole dogmas around this disease has to change, and the awareness has to be massive, and it's the population at large is something which we probably need to educate right from, I would say, childhood, early schooling.
Yeah.
These are we are at a very impressionable age at that point of time, and it's very important that this needs to be entrenched into the society at large.
Also, Chavi, I think when we talk about awareness, it's so important that people like you should come forward, because one of the things that we also see is that a diagnosis, and I always say that with an ailment of this magnitude, is that the diagnosis comes for the family.
Yeah.
And how should the caregiver be? How should people around you be? So what motivates you? Do you meet now more cancer fighters and their families? How does that work?
As a social media personality, I feel that when we talk about the good things we do in life, we achieve, we get an award, we talk about it so proudly. Why would I not talk about something which is not going right? And I think by doing that, in fact, when I did it the first time, my mother really scolded me, said, why would you do that? Why would you just come out on social media like that? Even the family doesn't know yet. I said, no, you should have, tell the family, it's okay, because it's not something I can hide. And I'm so glad I did that, because I think by doing that, I got so much support from the community. And I got thousands of messages every day, and there were people rooting for me. And I thought, even if I couldn't reply to every single message, I always read it and I took their blessing. And I think it's those blessings which helped me in the long run. And also I realized that there are these two worlds that, that there are. One is the world that we've created for ourselves, where we have small issues, oh, my episode didn't do well, or my video didn't go viral, or I got a bad comment, I'm getting trolled. Then there's this world where are these people who are trying to survive. They are fighting for the basic survival in their lives. And it just opens you up to an entirely different perspective in life. I think I'm so much of a better person after knowing that side of the world that I was at that time. I think I was like a kuएं का मेंढक at that point. And now I feel I'm connected with so many people and it feels amazing. So, I mean, it's one of the best things I did, that I came out with it and I shared my journey.
I think you're doing a wonderful job, because at least that awareness is going to them via that. Having said that, access is still a huge issue. Whether it is intervention, whether it is awareness, how do we bridge that?
Any innovation that comes in, and especially the diseases like cancer, should have an access to the patients, because it's really bending the curve of their life. But access is a multidimensional approach. It cannot be just one stakeholder's responsibility. A lot of stakeholders have to come together. And I must appreciate Government of India for their JAY, Prime Minister Jan Arogya Yojana, which is commonly known as Ayushman Bharat, which is making things more accessible to patients. The second important factor that we are constantly seeing is the increase in the penetration of insurance. Today, we have got 34% of our population which has got some type of insurance, which makes them more accessible to these treatments which are coming forward. In Novartis, for last almost 3 decades plus, we have been constantly striving to get innovative therapies for especially diseases where there is a high unmet need and there is a high amount of intent to cure. One of the examples is our CDK4/6 for breast cancer, for HER2 negative, HR positive breast cancer patients. We have shown overall survival, which really helps the patient to live longer and live well with lesser side effects. Through Treat to Beat, also trying to bring across the awareness that for breast cancer, we have to come together as a community. We need every stakeholder. While every patient, the doctor provides them the best treatment options, and the family and the caregiver should also ensure to know that what is good for them. As pharmaceutical companies, we are bringing innovations into the country. We need to work with governments, we need to work with patient organizations to make them accessible to patients so that we are able to bend the curve. And that's what this whole Treat to Beat is, that treat the patients to beat the cancer. And that's what the whole working with Sanjeevani is, to get access to patients faster with these innovative treatments.
Last
Just
word.
to add
Yes.
to what Amita said, for prevention, you don't need to meet an oncologist. You need a primary care health delivery system to do this job, because as you know, a pap smear for cervical cancer, you don't need an oncologist. For a simple clinical breast examination or a mammograph, you don't need an oncologist. So it's a myth that you need to go to a tertiary care cancer center to get detected for a cancer.
Chavi, any parting thoughts? Anything that you would want to tell our audience?
Getting diagnosed with cancer, in my opinion, is not much worse than getting diagnosed with any other bad disease. So, I mean, just that fear of the word C needs to get out of the system. And the way I look at it, every time we have a problem in life, suppose the business fails, I think that is so much bigger. You come on the road, you don't have food to eat, that is so much of a bigger problem. People have so many problems, but you face them, right? You just don't feel that, oh, why me? Or why me? Now everything is going to get sorted. So just saying that the attitude towards cancer also needs to be that it's a problem, there is a solution, step by step, one day at a time, I will beat it.
Don't fear the word cancer. It is just like any other chronic disease. Fight it, try to beat it, and then try, after you finish with that, try to get back to normal life. That's the whole intent. You should have a good quality of life and you should get back to normalcy. That's what we want for every patient.
Thank you, doctor. Thank you so much for joining us. Thank you to all of you for giving us your time and insights. Thank you so much.
Thank you.
Thank you. Thank you.
Well, as we strive for better outcomes for breast cancer patients in India, it's important for all of us to stay informed and equipped in the fight against cancer. With that, it's a close on this episode of Treat to Beat. Thanks for watching.